There we go.
All right. Good morning, everyone. I'd like to introduce myself. I'm Kim Schlessinger. I am the co-chair for the Access to Care Subcommittee, and joining me is my other co-chair, Emily Cronin.
Good morning.
And okay, well, today on the agenda, it's kind of a broad agenda. It's kind of open. We have proposals and recommendations, and I thought what we could do is try to summarize the feedback and input we have received over the last 3 months here. We have received a lot of great comments and information from a variety of sources. And I want to just thank everyone for their contributions to the meetings. And trying to take this large body of information and somehow present it in a way where we can digest it and formulate it into some recommendations. The thought that Emily and I had was to use our scope of our scope and our objectives that we set forth at the beginning of the subcommittee, and put that in some sort of order where we could look at that and get all of your feedback on what would maybe be the priority then for the next meeting, coming up with some like concrete recommendations for the larger MLAC meeting. I think we also are waiting for a proposal from our SAFE representatives. I think at the next meeting, Terry, if I'm correct, will be submitting another presentation for the subcommittee to consider.
Co-chair, SAFE did present a 2-page memo, and it is on the Access to Care website. So that is available. And also Lon Holstein has a proposal that is on the Access to Care website. He's not able to join us today. And also Dr. Sable has a 1-page chiropractor proposal. It's not a proposal, it's more of an informational 1-pager. All that information is available on the Access to Care Subcommittee website, along with the information that you and Emily put together with the updated scope and objectives, and then all the problem statements. So all that information is available on the Access to Care website.
Okay, so will there be any presentations by Lon or Evo today?
I don't believe Lon is not available. Evo is in the meeting, but I don't believe that he's ready to present, but you can ask him since he's in the meeting. There he is.
Yeah, thank you, Terry. Madam Co-Chair, no, we just wanted to follow up on a presentation from, what was it, 2 weeks ago, and submit something in writing. So
Okay.
you have them available. Thank you.
Great. Okay, so there's a lot of information on the website. If people have access to that, then maybe what would be the easiest thing is for us to pull up then the summary of comments. I think it's titled on the website the MLAC ATC objective and problem list. I think that's the one we're working off of.
Co-chair, would you like that up on the screen for everybody to see?
Yes, I would. Thank you.
Okay, Baba is working on that. Here we go.
Thank you. Well, just as a reminder, the objective of this subcommittee was to identify barriers to accessing timely and appropriate care in Oregon's worker compensation system, and to develop evidence-based, stakeholder-informed recommendation that support provider participation, reduce administrative burdens, and improve outcomes and injured workers. So with that said, the 2 objectives, the first one we had come up with was that we're going to look at access barriers to provider participation and explore expanded provider roles. So going back through the notes of the last 3 months or so, this is what we came up with. Please, for those listening in today and joining, if there's others that we missed that you feel are important, please, speak up and let us know what your thoughts were. These were kind of the highlights that, kind of some of the things that we heard. And what I thought we could do, we go through these, and if we want to prioritize them, there's some things we feel like things that we can then take forward to the larger MLAC committee. Those would be great to identify. And I know a lot of you, well, most of you probably haven't seen this until right now. So I want maybe just give like a couple minutes for people to look over this document and see what some of the bullet points, stand out for all of you.
I would just add, Kim, I would just like to add that, this is our first iteration of the document, and our intention was to really pull from all of the presentations, things we might know, conversations we've had with stakeholders, feedback. And so we're really looking at trends or themes. So like I said, this is not an or like Kim said, this is not an exhaustive list, but our first attempt at trying to really get something on paper around this very complex system. So we recognize this is, just bear with us as we're working through this, I guess.
Yes, thank you, Emily. It is a little overwhelming at times to think the task at hand. So I think sometimes when you break it down into more like manageable, bite-sized pieces, it's more doable. I see a hand, Elaine.
Yes, good morning, co-chairs. While looking through the list, one thought occurred to me for your consideration is the list it discusses barriers to provider participation. I wonder if it would be worthwhile to submit this list to the Medical Advisory Committee that's under the Workers' Compensation Division, that's comprised of different types of medical providers within the workers' compensation system for their comments and observations. It may provide additional insight and help to prioritize what may be pain points from their perspective as well. Thank you.
Thank you, Elaine. So there's a medical advisory committee. And does somebody have more information or how we would get this information to them?
Yes.
Sure. Good morning, co-chairs. Matt West, Workers' Comp Division Administrator. So it's early Friday. So similar to MLAC, the division supports MAC, Medical Advisory Committee. So we can make that happen if that's what you would like. They meet quarterly. I believe the next meeting is coming up maybe October. Don't quote me on that. But we can, they have a not Terry, but somebody like Terry who helps administer and run the committee meetings. So we can reach out to her and get this on their agenda.
That sounds wonderful. Thank you.
Yeah, Dr. Bowman, who came I think it was last meeting and spoke. He's the chair of MAC.
Yeah, I was looking in my notes just to confirm that before I made that statement, because I remember that as well. So we do have, or did in the last meeting, at least get some perspective and feedback from that lens, just to call that out. But I just wanted to be sure that that was the committee that he was a part of before I said that. So I was like, feverishly typing. So thank you, Matt.
All right, is there any additional thoughts, feedback, input on these bullet points that we have summarized? I don't see any hands.
Before we move on, I just want to call out,
Mhm.
I actually think that under objective 1, we may have made just a simple typo. I think it's meant to say assess barriers, not access barriers. I don't know how we
Okay.
manage that. I just the way it reads, I think that the intent was to assess, which is why we received all the feedback. And I think I've read this document 63 times and just now realized that that word is potentially the wrong one. So I just wanted to call that out before we move on to the next thing.
Can you tell me through this together in 24 hours?
I mean, but it's the same document, like since the beginning, it said access and we mean assess.
Yeah, so true.
What time do we start emailing each other, Emily? 6 o'clock this morning?
Yeah, I think it was like 5:45. Yeah. So I noted that. So if we can just maybe
We
make
will
an,
fix
yeah, whenever we update this next, that we did actually do the assessing. We just want to make sure that's reflected in our objectives. Thank you.
Okay, so we'll make that edit to the title of objective number 1.
And do we want to do something similar, Kim, for objective number 2?
Or go on down to number 2, which is identify and recommend policy and system changes that reduce administrative barriers. So we have come up with some additional bullet points from the presentations that kind of fit into that objective. Okay, any thoughts, comments, feedback, additional edits for the second objective? Don't see any hands. Okay. And again, I know it's the first time you're seeing this, so it might just be some things might come to you later on, and please email Emily and or me with those thoughts or additions. Yeah, what we could, I thought maybe then do is, so we have one more meeting after this in 2 weeks, and I think that's the meeting where hopefully we would be able to identify then the recommendations that we would like to move forward to the larger MLAC. So we have time today to maybe prioritize the bullet points and objectives 1 and 2 that we would like to then to see move forward. So is that something we can do today? Is that okay with everyone? These virtual meetings are so hard because I have no feedback from
I'm
anyone.
wondering that when we're talking about looking at objective number 3, where we're talking about mapping system level pain points, I'm wondering if we could get a little bit of maybe guidance as to kind of where each of these would fall within the bucket of authority and rulemaking, and like who's on first around how some of these solutions might be guided. Is that making sense to Terry and or Administrator West? I don't know who is in charge of what fully, as far as making some recommendations and solutions. I'd love to bucket it in like, here are the solutions and recommendations we'd like to discuss as it relates to the rulemaking for WCD versus outreach, might fall under the bucket of MCO support. I don't know that, and it would be easier when we're talking about the system as a whole, maybe for others to understand if we're looking at making a recommendation, for example, around educating out in the community. Is that falling under WCD? Is that falling under MCO? Is that falling under both? Those kinds of things.
Yeah, I would say that makes sense and would help us, with the plan moving forward. We have a really sharp policy team, I think, that can help us, internally with some of that. What are some things that we can, as you mentioned, Emily, address within WCD, or if it's more of a industry. So yes, we can work on that for the next meeting.
So can I ask a clarifying question? Would you like us to go through this list right now and do that? Or what are you suggesting, co-chairs?
Well, my thought is that we would, if we could, since we have the time and we have, a lot of the stakeholders here online right now, to at least go through some of these bullet points and like, what are the ones that, really like stand out, like the priority ones, that then we could, maybe come up with some concrete recommendations for going forward. That was kind of my thought for today.
We can just start at the top and go through the list if that's what you want to do, and see if there's input and what people think.
Okay.
So if we started with the delayed care, coordination of care burdens, difficulty to coordinating diagnostics, including access to provider network and time loss delays, difficulty accessing a specialist, prolonged response time from adjusters. So there's really a lot of things in that one. It's not really just one thing. So do any of the stakeholders have anything they'd like to add to that, and the best way to tackle that first bullet?
Just a nice low-hanging fruit bullet. No issues there. It's like super solutions based. I'm just wondering if coordination and trying to figure out what goes where is like our first step. And again, like to unpack all of that, right? Like some of that falls within provider networks, and that then ties to outreach. Again, we understand that this is like sort of a spider web labyrinthine kind of situation. So I guess my ask would be to our stakeholders who I'm grateful have taken the time, how based on this list and kind of the path that we're going, what are we missing? Are we on the right direction? I mean, I know some of these things we're hoping to make very concrete, tangible solutions that I would say are sort of low-hanging fruit in a way that we can make small adjustments pretty quickly with things like interpretive guidelines or clarification on certain rules, and then some outreach and education. But, you know, this is a subcommittee designed to improve the access to care. And so we've got 40 people in this meeting, and all of you are very brilliant and probably smarter than me. And so based on what we've heard, what are your interpretations? What else do we need to be considering? You know, what else, I guess? Because I do think it wouldn't make sense to run through this list bullet point by bullet point. When we're looking at mapping, we really need to figure out what goes in what bucket. And I think that's something that we can do in preparation for the next meeting to clarify, like, here are the recommendations as it relates to rulemaking. Here are the recommendations as it relates to outreach. But I think now would be great to just make sure that this seems like a good start, and get that kind of feedback. I see a hand.
Mhm. Hollinger?
Yes, hello, Giovanna Patrick. It's my company there. I'm here for OTLA. I just wanted to thank, the co-chairs for all this information. It's really good to see it all on one page there. I love the idea of putting this in buckets because it seems like there's a couple main issues going on here. One of them is enough doctors in the system, right? And enough doctors willing to participate in either occupational medicine or MCO, or the big hospitals not letting their doctors in. So that's kind of one issue. A secondary issue, and I think a really big one that we've seen, is the communication problem, and getting quick and clear access to what's accepted, what's denied, what doctors can and cannot do, and frankly, insurers and adjusters just getting back to doctors. We have a rule on this, and what we heard from doctor after doctor is the slowdown in the system is they're not getting information back from adjusters on authorizations and approvals and things like that. There's a discussion of a portal system, or like a streamlined way of requesting authorizations, because it sounds like that's another big issue, is that doctors don't want to be in the system because they have to hire someone who can figure out this billing, and it's very confusing. And so I think those are kind of like the main buckets that I see, at least, access to, or enough doctors in the system, the timely response on authorizations, and just the complication in having to have extremely trained staff to even try to tackle this. Those are the main buckets that I see, and I look forward to us all working towards resolving some of those issues. Thank you.
Thank you. That's very helpful.
So Emily, can I ask a clarifying question? Because that was really
No.
helpful what you shared. And if we have like a rulemaking bucket, a outreach bucket, timely response bucket, and then you said, each could go to whoever for the, what needs to get done. But as I look at the buckets now, I think everybody can have a piece of that bucket.
Sure.
Does
I
that
guess
make
in
sense?
some cases, like we've heard a lot from a bunch of different perspectives around, I'm just going to use an example, around not being able to direct care. We spoke to a provider who has a different perspective, working in both Idaho and Oregon, and some of the other stakeholders have shared that complication. And when I looked at the rule is very clear that it states it cannot restrict my right to choice as an injured worker, but it doesn't say anything about not offering, I'm going to use preferred vendors list, like not providing an initial set of resources about which providers do accept. And so that could be something as simple as like a CMS level, like an administrative guideline or an interpretive guideline around that regulation. That is something that might be something that WCD does. I don't know if that has to go into rulemaking or not. There's some of the administrative processes that I'm not super familiar with, but that's kind of what I'm thinking is like, of these solutions, who would be responsible for them? And that would then allow us as well to look at what sort of impact or ask that we would be making, and whether or not that would be feasible, whether it be fiscally or capacity based. And so that is kind of what I'm thinking. I agree that when we're talking about, like Giovanna mentioned, timely response, right? That's everybody's problem, and probably in every aspect of the process, we could see improvement. So everyone would still be responsible for that. But in something like that, like who's in charge of making that a stronger rule or the enforcement mechanism? And that's a piece I'd really love to see as part of our solutions, is to bucket them. But then, yes, like they may end up in more than one bucket, but the responsibility or the action items that or asks that we're making around that solution would be different, maybe for WCD as it would be for some of the large hospital systems, et cetera. Does that clarify what I'm hoping to get at?
Yeah, that makes sense. Thank you.
I kind of see that, Emily, when you were saying that, in my mind is like, we come up with these, these buckets or, these categories. And then kind of in the next column, we would have like, like an action item or, who's responsible, like our follow-up, that would correspond to that, that category.
That's actually a
Yep.
great idea. When we're talking about increased education, you had mentioned certification for the billing processes, or being able to offer resources to smaller practices or people who have cited that is a significant barrier to them providing, is not understanding the reimbursement structures or some of the processes for billing. And so that education might fall within several different stakeholders' responsibility. So in that, we would create the action item of increased education and a couple of topics that would be really relevant. And then the responsible parties might be WCD and MCOs and private insurers, whoever is going to be responsible for providing that education, to make the process more familiar to more office staff, administrative staff, and that would increase proficiency, but it might go to multiple different stakeholders as a responsibility.
Mhm. Yep. So I'm just trying to determine like how much more time we need to really spend as this large group to go over this. It may just be that, we, just have people follow up with us offline. Elaine, I see your hands up.
Yes, hi, Elaine Schooler with Safe Corporation. The bucket idea is great. I think that would really be helpful to synthesize and organize these bullet points, because there's a lot there, and even some of them have multiple pieces incorporated under a single bullet point. It is challenging to prioritize at first blush. It would be helpful to be able to digest the information a bit more. A possible suggestion would be to have that report or that bucketing done in advance of the next subcommittee report or meeting, excuse me, maybe a week in advance or so, and then have some stakeholder homework where there's an expectation that that report would be reviewed and issues prioritized, and then stakeholders be prepared to explain how they prioritize the issues and the why behind it, to create a robust discussion at that point in time.
That would be great. Okay, so we would need to then, have this kind of ready. We can push this out to this group by email, I would assume, and then have everyone who's participating in these meetings, you kind of weigh in on the different, the categories and the prioritization of those categories before our next meeting. So I think the next meeting is in 2 weeks, so we would need to get this out to you by next week. So does that sound like a plan for everybody?
I mean, it sounds doable to me. We also have the opportunity, since we'll be meeting with the larger, like, I mean, I'll see you in Bend in a few days, right? There might be
Yes.
some time there as well. I do think prioritizing this in a way that is mappable to be able to share with stakeholders is worth the effort to try and get it out a week in advance. I think that's a great suggestion, Elaine. Especially too, in thinking about these buckets and columns, I'm a visual learner, and the idea that once we put something in a column, something as big as like increased networking and accessing an additional group of providers, right, is a long-term sort of thing. And we can recognize that that is a solution and a recommendation that we make and is going to involve additional time and work with the stakeholders to kind of get that to fruition, whereas some of these other components might be simpler, if you will, and be recommendations that we suggest, rapidly to alleviate some of these sort of smaller, again, low-hanging fruit options. So we would be able to prioritize them that way as well, as far as how much time to get a solution implemented if everyone is in agreement. We can prioritize them that way as well. So like, I don't know, red, yellow, green or something along those lines. We can kind of talk through that.
And I would think the report would be posted to the subcommittee website too in advance for individuals also who may not have their email readily available or want to participate and haven't in the past. Give them a clear point of access as well.
Oh, good. Yeah, that's a great idea. So I think, Terry, that is feasible to do that.
Yes.
Great, thank
Okay.
you.
Thank you. Looks like Kirsten Adams has her hand up.
Hi, thank you. I just wanted to echo, I really like what you were saying, Co-Chair Cronin, about the idea of that there's kind of a like a multi-layer of the solution here, that, there's a lot of different pieces that go into the issues in the system. And so I kind of like, I just wanted to echo, I like what you were saying about looking at the low-hanging fruit, but also some of the bigger challenges and kind of figuring out different solutions that, it's great if there's one silver bullet that fixes everything. But I think that looking at all the different solutions that might be out there and different ways to get at that. I just wanted to echo, I like that idea you brought forward.
Well, thank you very much. I like the idea that there's not a silver bullet, but there are things that we've heard in trends through these conversations that do feel relatively simple to make small improvements sort of right now. And I think that that's really important in trying to solve this larger systemic issue that we're going to continue to see complexities around our healthcare system in Oregon in all aspects. So like, I just want tiny wins. The tiny wins feel great in having these conversations and getting this feedback that we can remove these small barriers, like whether or not we look at interpretive guidelines around restricting care versus directing care, right? That could really improve the lives of our injured workers very quickly if that's doable. And I want us to take credit for that. I want to make those changes quickly so that we can start to see incremental improvements that over time will also, compound some of these larger solutions that we might suggest. So.
It also seems like some of these, the issues are already being worked on. Like there was the issue about the time limit for the NPs and PAs to treat, like there was 180 days, but there was feedback we had gotten that some of that has already been, it's already in the works to extend that. So it seems like there's already work being done on some of these issues, and that might be great just to document those that like, hey, we recognize this is a problem and it's already, it's already being addressed.
You just brought up a great point. I don't want to add work because this I feel like would fall to Terry because Terry's the policy liaison. But I'd love to, when we're looking at specifically, I don't know if we can do it in the week, in a week, but eventually what I would love to see in our final report or final set of recommendations is that there's a crosswalk to any of the ORS, OAR regulations that are there. So it's easy for people to understand. We're making a recommendation on something. Again, I'm going to go back to the restricting choice versus directing care thing. I would love to link the actual rule as it stands now as a reference point for people who are interested as stakeholders to look at what these solutions are really looking at in tangible ways. I'd love to crosswalk some of that if it's relevant, but probably not by next week to be able to get it out for people to do feedback. Is that doable, Terry? Again, like, is that something we could consider?
Yeah, but you're gonna have to give me a little time.
No,
Exactly.
right. I just mean like like for the final, it would be really nice to add that to make a more comprehensive report where people were able to crosswalk what we're referencing in these things, but no, not now, not next week either. I would just like to propose it as an option, if we can, if we do have capacity to do that.
Yes.
Okay. So do we have any additional thoughts or ideas about how to move this forward? This has been really helpful. I appreciate every one to give us this guidance on how to conceptualize all of this into a nice readable report. The other items that are on the website. So Terry, what my understanding is people are just going to look at those and then maybe, further presentations or comments will come in the future.
So at the next meeting, we will have SAFE give their presentation because that was the whole why we came together as a subcommittee.
Yeah.
And then we'll need to give a recommendation on their proposed LC that will be coming forward. And then I will get this all together and probably up on the website. If I have people's email, I'll email it to them by next Friday at the latest. And then with the expectation that everybody will review it and come to the final meeting, and we'll put the final pieces, because on October 2nd at that MLAC meeting is when the subcommittee will come forward and make their recommendation to the full MLAC about the subcommittee recommendations.
Okay. All right. Well, I mean, so that helps. So that's very helpful. Kind of, gives me a time frame of what needs to be done. And so I think, was there any? Let's see on the agenda. I think we're at the public comment section.
Can I ask a question first?
Yeah. Oh, yes. Go ahead.
Thank you. And this may be a very naive question, so I apologize. In looking at the recommendations and the conversations we've had, there are some instances that admittedly I do not know who's responsible for that problem, not the problem, let me rephrase. So when we hear something around delays in authorizations coming to the injured worker, like an approval for physical therapy a couple times a week for 4 weeks by the time that it's received, and they're already 2 to 3 weeks past that date, and then they also have to get an appointment. I know we talked about some of the solutions around speeding that up, whether we're using snail mail versus digital, but my question is, if we wanted to make a recommendation around those types of things, in the sense of we would make the recommendation that the therapy should be frequency-based and not date-based, is that something, who's responsible for that? Who makes that decision? And when we have questions like that, who do we even ask? And is it reasonable for us to ask within the scope of this conversation or while working on some of these recommendations? I don't want to make recommendations on solutions that like aren't possible for whatever reason that they're not possible.
Yeah.
So.
Yeah, I think Emily, you could start with us and we could, talk to our policy folks, see if there's something in rule or statute that addresses the specific scenario. And if not, then it could be a broad, like, I don't know if it could be a broader. Then we can put it out to the broader group, I guess, to see if there are limitations within different healthcare structures or,
Okay.
but yeah, we can certainly start with the division and we can look at current rule and statute to see if there's anything that addresses a specific scenario.
Okay. Okay, that's
So,
helpful.
Emily or co-chair, with this list, I can give it to the policy analyst and we can go through and say, look at it and find
Sure.
out. But what buckets they go in and what is the best way to deal with it? How's that sound?
Yeah, that sounds great. I think the reason I keep bringing this up is simply the fact that we know there are problems in a very complex system, and we hear them and they seem like simple solutions, switch in the way things are worded or written, but like that's not necessarily true. Otherwise, I guess somebody smarter than me would have done it already. So I'm curious about making recommendations that's a strong, like I feel very strongly about that seeming like a simple problem to fix around mitigating unnecessary time loss for having to re-auth multiple times for something due to the fact that can't find a provider or the mail gets lost or whatever the case may be. I would love to make that recommendation, but I don't want to make that recommendation to the ether if there's not anything that we can suggest, write a rule on, fix a rule on, or truly strongly recommend. And I think just looking at this list to make sure all of these fall within actual solvable recommendations is important to me. When we're, I want this to be meaningful. So mainly that
Yeah.
one. That's the one I'm just not sure about. It's like the only one I'm just like, I don't know if I can tell people to do that or not. So
Maybe,
Sorry, I was just gonna add, that's a great question. Like I said, we
No.
can look into it, and if there's not a rule, and we feel like it's right for rulemaking, if we need to put some language in rules, we would then go through the public rulemaking process for, stakeholders to weigh in on if the rule is appropriate and how it should be worded. So there would be further discussion on it before, like, we can't just go and, not that you're suggesting this, and just like, okay, we're gonna add this rule. We always do open, transparent rulemaking where we want everybody to weigh in. So that could lend to further discussion and maybe further suggestions.
okay. I think I just keep needing reassurance that it's okay to make a suggestion or a recommendation like that if we see it as a problem that we see a concrete solution for, and then take it from there and see if it's doable and applicable. Okay.
Yeah, and if you
Yeah.
did, and it was something that we determined we don't have rulemaking authority to address, then we would certainly let you know.
Thank
Yeah.
you.
and just to tag on to Administrator West, that idea is in my mind, Emily, like we'd have these categories and, the who's responsible or the follow-up, but there can also be a category where it's just future considerations. Like, I don't want to, not like have this on the report just because, that we don't have something really concrete to someone to do it. But it's like one of those things that somebody might see that, maybe someone from, an MCO or an insurance company or someone that could maybe make some of these changes, but if there's not like a direct regulatory, statute to make it happen. But it could just like one of those, like, plant a seed in somebody's head where, oh, we can make that. That's a simple, like, internal, business decision change or something, so we could kind of make another, just like a catch-all category or something. Let's see, I see a hand up for Ann Klein.
Yes. Hi, good morning. Ann Klein with Majora's Health Systems. And Kim, you queued me up perfectly because one of the comments I just wanted to share is that there's a number of suggestions and opportunities that have been highlighted through this process that really don't require some official process. It's simply feedback that we're getting. And I believe that we have all of the stakeholders very committed to continuing to improve and strengthen the system. So that perfect example, which Emily also queued me up for, on sometimes it seems like maybe it's just a small tweak. We've already, in listening to the feedback regarding the physical therapy pre-certification decision specifically, there's some background, which I won't burden everybody with, on why specific dates were provided. But what we really crystallized as we listened to some of the feedback is the solution the dates were there for was creating a larger problem. Right. So in that case, let's choose where this more streamlined pathway is. And I already have with my programmers work on updating how we issue decisions on physical therapy to focus on frequency and a time range that provides buffer and opportunity for flexibility so that we have a little bit more opportunity to address when there are those delays or hiccups, whatever it might be. So sometimes it really does just require this type of conversation to say, hey, why not? How come? That it then just next step.
Thank you, Anne. That's great information to know, you know, that how these discussions are playing out. So that's really nice to hear.
That makes me very happy. I know that's not the point of this committee, but I just want like that. It makes me very happy when we can have open conversations and sort of bring to light some issues that like they're just an unnecessary problem, right? There's already so many complexities that some of these over limitations may have solved one thing and then you don't really know what the, you know, collateral damage of that is until we start to get feedback from injured workers and some of the stakeholders. And so to hear that something like that could be fixed easily to allow for some delay of human error and scheduling and stuff and not have to continually go down this sort of cyclical worsening situation where I really strongly feel as a nurse like it's so important continuity of care, and so to see those small changes being done like makes this really meaningful for me. So I'm very thankful that you shared that, and I hope it's more, we have more things like that come out of this subcommittee. So
Okay, so are we okay to move on to the, if there's any public comment or any stakeholder feedback? Should any
Coach,
further?
I
Yes.
have one, just one additional piece of information related to MAC. So their next meeting is October 31st. So the timing is, I think, is good as we, so it might be good as we're looking at buckets and narrowing down the list, if we can you know, highlight the ones that we would like MAC to, you know, provide input or have or further consider, instead of giving them like this giant list. If there's certain ones that are specific to MAC, might be more helpful. So just want to throw that out there. I think the timing's good.
Right. Okay.
And MAC meets in Wilsonville, correct?
Yes, they meet at the, in the Durham office.
Durham office, okay. Right.
Then also, there's always the option if someone from MLAC would like to come in to MAC to share some thoughts, that's always an option as well, or we can bring the list forward.
awesome, thank you. I have a question for Terry, just in sort of process and next steps. Am I understanding correctly that at the moment you and the policy team are going to kind of pick through this and put it in buckets? I'm happy to participate in that. I just want to make sure that I understand what our asks are over the next week to ensure that we get this done and out to the stakeholders to have a robust final conversation. So
Yes, that is what I'm gonna do, and then I'm gonna get it to both of you. I'll probably see you Monday, so I'll probably hand it over Monday. And then ask for your edits at that time, so we can, and you know, I have to have my administrator look at it too. So we'll review it and then try to get it up on the website by Tuesday or Wednesday at the latest, so people have plenty of time to review it and get feedback.
that would be great. Again, Elaine, thanks for that suggestion.
Yeah. Yep, that's, yes. Sounds great. Or if there's anything that we missed, please, let us know. We want to make sure that we covered everything. I went through, 40 pages of notes, I think, and the minutes and, there's lots of information. So if there's anything we missed, please email me and let me know.
So I suggest, since it looks like we might be getting done early today, is we use this remaining the hour that was allocated to go through the documents that were posted on the website this morning, because I haven't had a chance to really to look at those. So maybe that would be a good use to with everyone's time, is to review that, and then also just to start thinking about the categories, uh, the different categories of how to group these. So does that sound okay to everyone?
I mean, it sounds to me like Terry and the team are going to kind of dig through that, and then the documents that were posted were the proposals that we would then look at against the buckets and sort of plan once we have it. So I'm not sure that that is going to be done in this group setting, since we're going to have Terry do what Terry's doing and then bring it, I guess, to us. So I'm not sure. Not that I'm immediately jumping for joy about the idea of ending a meeting early. However, just suggesting that if we have kind of our directives, that maybe we consider offering that up as everybody gets an hour back of their lives if there's not somebody signed up for public comment.
Does that work?
Is that okay, Kim? I mean, I wanted, yeah, how you feel about it.
Yeah, that we, let me sure I understand. Yeah, so it sounds like Terry and whatever the team are going to start working on this categories, the bucket list. And then we'll look at that early on next week to get it out to everybody, so that they can then provide their input and feedback for that meeting on the 26th, I believe it is. And then the documents that were posted today, actually, I haven't really had a chance to look at them. So that's what I'm going to be doing this next hour, but I don't know how that really relates to the category list. I think that's like just additional information for us. Is that right? Am I tracking this correctly?
I mean, I think so, yeah. So, yeah, because I read through Lon's proposal this morning, and then Dr. Sabo's updated information. So I kind of, for me, I kind of want to process and wait to see these buckets, and then what additional input we could have on columns to ensure the crosswalking is easy and that we reference the appropriate information. And I kind of want to spend that time once we get that, making sure that that's ready by Tuesday or Wednesday,
Yeah.
whenever we can. So
Yes.
I did.
Oh, I'm
Yeah,
sorry.
Oh, I'm sorry, Terry. Yeah, I did see Lon's proposal, and again, I didn't know where that all fits in to all of this. I mean, is is that proposal, do we need to like consider that in part of the buckets, or
No, Kim, I wouldn't think so. It's just a proposal that he had for additional providers. And we'll let Lon speak to it when he's available on the 26th, if that's okay. Yeah,
okay.
I don't think that, I wouldn't feel comfortable, speaking to it. And he'll be back on the 26th with my understanding, and he can speak to it then. Yeah, so I'm just gonna do a real quick summary, so we're all on it, so I feel like I'm on the right page. I'm gonna put this information together, meet with the policy team. I'll have a draft to you and Emily on Monday when I see you in Bend. So excited for that meeting. Stakeholders, if you haven't heard, our MLAC meeting is in Bend at the River House on Monday afternoon at 4:30. Hope you can make it. And then we will finalize it and get it out, hopefully on the website by Wednesday at the latest. So you will have plenty of time to review it. Okay, does that sound good? Okay.
tremendous.
Great. Okay. Sounds great.
Sounds good to me. So I guess then we will go ahead and officially adjourn the meeting give people an hour back in their day. Thank you, everyone, for your participation and your feedback and your help with this subcommittee.
Thank you, everyone. Have a good weekend.
Thank
Thank
you.
you all so much.
Okay.
Thanks.
Okay, bye.